Hi, good to see you. Hi, Monica.
Hello.
Hi, good morning, everyone.
Hi.
Hi, good morning, everyone. Official good morning, everyone. We are live on CMAAO meeting, weekly meeting. This is 77th meeting and lucky number. This is live international weekly meeting in association with COVID, in association with CMAAO on COVID. We are on 25th of September and people are joining in from various parts of the world. Today, last time we could not have an update on COVID from the medical association because we were doing a very important topic on nutrition and it took the entire session. So today we wanted to do a session specifically on the COVID update. And before I can invite all the member participants association, I would like to introduce. Today we have Dr. Chong from Singapore Medical Association, also the chair for CMAAO. We have Dr. Ravi Naidu, Malaysian Medical Association, past president of CMAAO. Dr. Ashraf Nazmi joins from Pakistan Medical Association. Dr. Alvin Chang joins from Hong Kong Medical Association. Dr. Pillai joins from India, member of World Medical Council. Dr. Salma Kundi joins from Pakistan Medical Association. She's a president. Dr. Angelica and Dr. Akhtar Hussain joins from South Africa Medical Association. Dr. Jamal Chaudhary, Bangladesh Medical Association. Dr. Prakash, Nepal Medical Association. Dr. Benet, Philippines Medical Association. Dr. Deborah from Brazil. Dr. Marie from Japan Medical Association. Dr. Russell, Australia, UNESCO. Dr. Qazi, President-elect CMAAO, and from Pakistan. Dr. Singh from Korea. And we also have some more guests over here. Dr. Shashank Joshi from India. Dr. Monica Vasudev from US. Dr. Sanchita, IGCP Group India. And Dr. Bukhari from Pakistan. We will now move forward with the update. We have people joining in. Dr. Chong, would you like to chair the session with me on this? And we can have an update from starting from Korea because I think this is the first time we will get a Korea update. So Dr. Singh, we would like to take the honor to start the meeting with you.
Yes, I'm very much honored and thank you. And today, just a couple of hours before, I was forcibly informed from the email. So I was very happy and thank you for counting me in. And I'm a professor in Yonsei University Medical College in Seoul and also advisor to Korean Medical Association and also CMAAO. And sorry, I'm not very much prepared because I had no information what will be going on in this meeting. But I'm very honored and happy to be a first speaker. But the speech is very, very brief. Korea, the COVID situation is so and so. We have around 2,000 patients, new infection in a day, especially in Seoul metropolitan area. It's above 70% of the patients. So we still have a high level of it is not a lockdown actually, but high level of social distancing still. So people are very much tired, and but Korean people are still very much joined the government program for the social distancing. And the severity is slowed down, yes. coming down and down, and also mortality is very, very low. So we do not much worry about the severity or mortality. However, we are still worried about some new infection and variants like Delta or something like that. And infection and vaccination rate, first vaccination is all above 70%. However, the second booster is quite low still. It's under 50, 40 or so. So now we are still going on for the vaccination. However, recently people are somewhat worried about the side effect of vaccination. So I think we need more risk communication for the vaccination side effects. That's all my report. Thank you.
Thank you, Dr. Sin. Over to Chong.
Thank you, Dr. Shin. And for all of you here, Dr. Shin was my predecessor. He was the chairman of CMAAO before me.
Oh, yeah.
So happy to see him back here. Okay, why don't we just start with Ravi from Malaysia to tell us what's happening. Thank you.
Thank you. Thank you. Well, we are now recording cases below 20,000 now. It's been for last 1 week, 15,000 cases. The worrying part is, of course, the number of deaths are in the region of 300 to 400 plus every day. But saying that, we have had 80% of our adult population have been vaccinated. They're now going on. They're now going on to the adolescents, from the colleges and universities, and they're now discussing about the booster doses for the frontliners and those senior citizens with comorbidities. We have not got any final outcome yet, but the ministry is in the process of having a discussion on this. However, I think from 1st of October, they're going to start vaccinating the booster doses for the frontliners. We do not know how that's going to work, but generally, I think we noticed that the frontliners should be given the booster dose, like our chairman, Dr. Chong, has given that he's increased after his booster dose, and so he's better off now. So I believe that is a good test for us, that he's an example for all of us. Okay, thank you.
Thank you very much, Ravi.
Dr. Chong, can it be
Dr. Chaudhary, yes?
Yeah, can it be some, because I had some question to Dr. Shane actually, knowing from actually we're very glad that South Korea joined here. So I was just asking, what is the actually, just now, what is the number of infections you are facing now here per day? And Dr. Shane, do you hear me? You are muted. You are muted. You are muted.
Yes. Sorry. Your question?
Yeah.
How many cases a day?
Yeah. I missed your question.
I have two questions actually to you, because actually you know about the infection, that is the number of infections per day, and the death also. Number two is what about the telemedicine? Actually, I heard a lot of actually concerns from your side when we are joining the physically and CMAAO meeting. Here actually now it is randomly we are practicing during the COVID also, and also afterwards now. Now it is lessened, but the telemedicine is extensive here now. So you had some sort of concern in your country regarding the telemedicine practices. Can you just enlighten us about the telemedicine practices there? Whether
telemedicine in Korea, it is not very much popular. It is now under discussion, but it is not practically allowed. In some in some network of hospitals, they are now using in some extent, but now in Korea, we do not allow telemedicine yet.
But what is the point of concern actually that time actually? Because in Bangladesh we have just started and we are just forcing some sort of difficulties may we see like in Korea, so we can just overcome those problems. If you can just mention those things actually.
The major difficulty is the physicians do not agree, especially the practitioners. Hospitalists or doctors working in hospital, they are now agreeing, but local practitioners, they much worry about if telemedicine is prevail, their income or their patient visit will be dropped. Yeah, that's the major point, I think.
Okay.
So you suggested to restrict to some extent actually.
Yes.
The government was so willing to do that.
Yeah, that is desirable. So Korean government is now studying what kind of and what extent of restriction for the telemedicine use. So
I'm so just to add, I think I was reading this article. I think it said that 9 out of 10 doctors were uncomfortable because they could not make the judgment of the diagnose for the patients. So that is, I think, if I'm not wrong, Dr. Singh, you can correct me. So the doctors were not very comfortable doing a telemedicine, but I think now it is going. Now it is opening up. A lot of companies are starting up the comfort zone for them. But a lot of doctors had a problem where they said that they cannot diagnose or they cannot treat well unless they see the patient, because a lot of things, doctors can realize while looking at the patient physically.
No, Saurabh, actually, when we were talking with them, actually, they were telling that the physicians, they will face some problem in terms of their practice, in terms of the income, something like that. And the people just scrupulous people, they may take it in other way, or make it a commercialization. They may make it something like that. That is I heard. Is it Dr. Singh?
I think the problem with telemedicine in certain healthcare systems, like for example, in the Asian healthcare systems, is that funding access. Yeah, so I think these situations are quite complex. I understand where Dr. Shin is coming from about the KMA being up in arms against it. I understand, but it's a lot to do with the funding of the healthcare as well. So I think they are very concerned about rice bowl issues here. So I think it's not so simple. It's not so straightforward.
Yes, sure. Korea, as you know, the healthcare delivery system is very complete. So people want to go any kind of clinics or hospitals when they want. So, and accessibility is quite good. So even if we do not use telemedicine, people do not complain. Yeah.
Patients.
So yeah, patients do not complain about that. So I think so far our system is running very nicely. However, in the future, we do need some kind of restricted use of telemedicine for the efficiency of healthcare delivery in this COVID situation.
In fact, this pullback we have seen in most of the countries, not only in Korea. A lot of other countries have also shown that, and it's also the patient side. Also, they are also not very comfortable just taking a telemedicine. Just go 5 minutes, and it's like a miss out factor. Is that like doctor really? There was no connection issue. Did he really understand what was there? And even the patient side, the doctor says that, so in this scenario, Dr. KK actually started off where he said that you need to acknowledge the patient and the patient needs to acknowledge after what they have said, because it could be a connection issue. and you might have missed out a very important factor of telling. When you're like, face to face, you don't have that problem. And when we are talking about technology, you might be joining from a remote area, you might not, connection could be an issue. So those pullback factors were always there, and it was something which a lot of people were it's a new for them. So it's always a pullback which is there.
And interestingly enough, I looked into this aspect of it, which I didn't realize, that Asians don't really like to see their doctors. For example, on a phone, they don't like FaceTime. They rather keep it because they apparently it's some cultural bias or something. It's quite interesting that they don't want to. For example, they're at home and they're in a mess. They don't want to see their doctor. In that state.
Yeah, moreover, and also there's a privacy issue, because when you're doing in a closed room, it's a different privacy. When you're doing on internet, it's hacked or something,
Yeah. So
there are a lot
example,
of issues.
FaceTime isn't that popular in Asian cultures, as for the iPhone, as opposed to the SMS and so on. Messaging is more popular. Quite interesting, some of these cultural biases.
Yeah, in fact, this is an interesting topic. I can bring a speaker on this. This is something which is like something which
Saurabh,
can really help.
Saurabh, can I say something?
Dr. Sajjad, yes.
Yeah. Actually, this is. I mean, you all are very absolutely correct. But the thing is that being a ENT surgeon, I'm a ENT surgeon practicing, and it's very difficult on the telemedicine that how can you just diagnose that there is a perforation on the tympanic membrane or not. So the people and the patients should want, they want to be that their tympanic membrane is intact or not. So if you examine them physically, then they will satisfied, okay, doctor have seen my ear and his diagnosis is correct. But on telemedicine or through this technology, I think at this moment, and Dr. Chong is absolutely right, that we, the Asian, is more interested the telephone as a social media, WhatsApp, Facebook, and this all. We are not so much trained. The patients and the public are not so much trained with this. And but even then, this is a very helpful technology for the remote areas, for the villages, for the areas where the doctors are not available there or the technology is there. So it's very difficult for ENT and eyes and for these type of patients to diagnose accurate diagnosis. Thank you very much.
Thank you, Dr. Sajjad. Can I get Dr. Russell to speak next, because he's leaving for a meeting shortly? So get Dr. Russell to update us on what's happening in Australia.
Thank
Dr.
you.
Russell?
Thank you, Dr. Chong. Yeah. Australia, we continue to have two countries, two states. Half the country is in lockdown and cases are going up, and the other 4 states have no cases, virtually no cases, but no moving between. But one good thing is that they are working on the vaccines, and so we are. I think around 70% has been reached, but as soon as it reaches 80%, they are going to. That's the agreement, national agreement, that they're going to open up, irrespective of cases or no cases. And so the whole focus now is on large centers besides the GP. Which is the Commonwealth. They have big centers opened up where you can walk in. Even drive-in vaccines centers are there. So that's pushing ahead with pretty much they brought in the Moderna, and so we've started. I think about 50% of the 12 to 16 years have all received their first dose of Moderna, and the the Pfizer. So that continues, and so all are waiting now for there's been some protests and so forth, which you would have seen. There's a group of anti-vaccine people, and that group, ironically, for Monica to hear, the protesters were holding Donald Trump's flag. I can't understand why they're using it in Australia.
And so, and so they're using his.
Oh dear.
So they're anti-vaccine people and not refusing to wear masks. And one group of people that was there. Anyhow, so that's pretty much from Australia to the country with two parts of the country. So, and they, of course, Western Australia insists that they will only open after it reaches 90%. And of course, the argument is that they are living a normal. They have absolutely nothing. They're doing everything like what it was 2 years ago. So they don't want to open. So that's the way it is. Thank you very much for that, Dr. Chong, and thank you all for that. Thank you for that.
Thank you, Dr. Russell. Maybe I'll get Angelique and Hussein, Dr. Hussein, to speak about what's happening in South Africa. Can we do that? Angelique, Hussein?
Morning. I've just sent to Hussein also all the information, but good morning. You know, we are busy here in South Africa with looking at the second Johnson & Johnson dose after 6 months. The new studies that has been published recently this past week show that some of the antibodies decline, or that your antibody decline. And if you get the second Johnson & Johnson shot 6 months later and 9 months, the immune response are really very, very good. So on the, hopefully that would be available for our healthcare workers first, before we see our next wave, which we predict would be December. That's the first thing. The second thing is, you know, I was listening to the telemedicine conversation, and my personal opinion, well, two things. In South Africa, it is allowed. And I think that especially around psychiatry, they and psychology, they would be the most advantaged, or most it worked very well in their field. But for me, my personal opinion as a clinical practitioner, I'm still of the old school. I want to see the patient. I want to look into the ear. I want to look into the throat, and I want to touch the patient. And I find that very difficult with telemedicine. But I think the place for telemedicine would be where I am sitting in my office, and I've got a nurse assistant or another person in a deep rural area, and I can sit and I can monitor and I can guide them, and I can help treat from a remote place those patients. I think that's where there's really not enough people. So, or not enough healthcare workers to do the work. That's for me the value in telemedicine. Or when I want to, again, I can't send my patient to the specialist, and I want to have a consult with the specialist. In other places, I don't really think so, and I'm afraid we are going to lose the art of medicine if we keep on, you know, in where patients can actually come and visit you. Remember, even in COVID-19, with the second and third wave, in our surgeries, we saw every patient on a you know, I personally saw physically more than 600 patients were during the last wave that we had. And none of my personnel, and neither did I get COVID-19. We used the precautionary measurements that's supposed to be there. We strict with the patients. And that made me realize that we need to learn to live, how to, you know, how to examine patients during pandemics. Also, remember that everyone is now getting so afraid to get to the doctor that your non-communicable diseases, we are going to get a tsunami within the next 5 years of uncontrolled diabetes, HIV, TB, you name it, it's going to come. Because we have this thing that either you can do telemedicine, which I'm quite sure we miss a lot of clinical symptoms. Yes, there are gadgets out there that you can use, but that's only for the privileged because it's expensive. So for me, old school. I'm sorry. I'm very old school with that. And that's where I'll leave Dr. Atka to give you the numbers and the stats. Thanks.
Thank you. Dr. Hussain?
Thank you, Dr. Chong. Thank you. In South Africa, last 24 hours, 2,261 cases diagnosed, and the total death in last 24 hours is 312. And total 2.8 million cases has been reported and 2.7 million recovery. So our recovery rate is 95.2% at the moment, and total death is at 86,967 death reported. Still 50,000 is active cases of COVID-19, and 17.5 million tested confirmed till today. Total 6.9 out of 2,261 cases, but the average 9.2% from 5th of September to the 11th of September. Patient admitted, total admission 7,281 cases. People were admitted around the hospital in South Africa. Out of that, 1,100 of them in ICU, and 600 plus patients were on the ventilator. And that's in South Africa. Thank you, Chair.
Thank you, Dr. Hussain and Dr. Atta. And can I have Dr. Chaudhry to tell us what's happening in Bangladesh first?
Thank you so much, Mr. Chong, Mr. Chair. Actually, in Bangladesh, the number of infections per day is around 1,000 now only, and the number of deaths is 20 in the 20s only. So it's good now. Everything is open here. It's people at school. But yesterday, I saw the news of getting the children getting infected in a school, and I don't know what the government is taking a decision regarding the vaccination. Actually, more than 20% has been given the first dose, and the second dose completed in near about 7%, like that. So we are giving this sometimes Pfizer, Moderna, Sinovac, and Sinopharm, and these four. And AstraZeneca was previously there, but unfortunately, just 2 days back, came to know this is from the Serum Institute where we got initially this, but they are not accepting this. Covishield, this is the name Covishield, but we know it is AstraZeneca vaccine, but I don't know why the UK government, they do not recognize it as a matter of entry into the country. So it's actually, we should, that previously Dr. Sajjad was very much vocal about this point. I also support his voice, because actually, whichever vaccines WHO is endorsing, why the other countries are not endorsing this? This is the WHO should take this point out, because this is the problem we will face when we go abroad, and a lot of people going abroad, and they're facing a lot of problems in this regard. So from CMAAO, actually, if the WHO agrees and they endorse the vaccines, so that should be also endorsed by other countries. What is the harm? Because I know the WHO doesn't give permission or endorse the vaccines in a very simple way. Still, the Covaxin didn't get the nod. So that way, actually, you can see that why not the WHO should come up with this point, and they should also raise this point. And 2 other vaccines actually are on trial here. There are 2 Chinese vaccines. One of them is a mRNA vaccine, and another one is the inactivated vaccine. So the mRNA vaccine, initially we saw that they're claiming superiority over the US vaccines, mRNA vaccines. They are claiming that more than 95-97% they're claiming. So we don't know that phase 3 trial is going on here now. So this is all about Bangladesh, and thank you so much.
Thank you, Dr. Chaudhary. Can I have Dr. Salma, Dr. Sajjad, and Prof. Ashraf to update us on Pakistan, please?
Okay, can I, with the permission of my president, Dr. Salma? Okay. Yes, the situation is in Pakistan is, thanks God, much better before, as before. Now, the number of cases is going down, and the last 24 hours, only 2,060 cases were reported, and the fertility rates is also going down. Only 42 patients died in the last 24 hours. Total, the cases recorded in Pakistan is 20. It's about 12,36,888, and total death in Pakistan is 27,524, and near about the more important issue I already raised in the previous meetings, that in Pakistan 229 doctors have been died in all this duration of the COVID. And the important thing is that the a few doctors, I think 8 to 10 doctors who were vaccinated, even then they have expired, and that is maybe because of their carelessness. And this is very unfortunate that we have lost 2 doctors with during pregnancy also. So, and they were also not vaccinated. So this is just for the information that the vaccinated people are much safer than the non-vaccinated people. What we have recorded here in Pakistan, that 85, near about 85 to 90% of cases admitted or in the at home, they were not vaccinated. Only 10 to 15% infected persons are vaccinated, but mild to moderate symptom. So this is a situation, and the vaccine situation is very good. In Pakistan, 70 what you call 7 million. Yes, 70 million, sorry, 70 million people have been vaccinated till now, and in a day, near about I think hello, so near about in a day, I think 1 million, rather I can say sometime 1 million people vaccinated in a day in Pakistan, or sometime less than that. So this is the situation. But with this report, I just want to know how many doctors are infected or died in other our country. And why? What are the reason, and how can we prevent them?
Dr. Sajjad, can I have a question to you, if Dr. Chong allows me, about regarding these doctors? Actually, you are just mentioning that certain doctors actually who are vaccinated and even then they die of COVID. Just can you say that whether they are too much comorbid?
Yeah, a few were comorbid with diabetes and hypertension and obesity, but few were very healthy young doctor. But the unfortunate situation was that when they get symptoms, they develop symptoms, they don't care. They used to do their routine works, and they thought that I am vaccinated. How can I got this virus again? So they realized when they got tested, and then after that they did all the preventive measures and treatment. But at that time it's too late. So we are just advising the people that when you have any problem like sore throat, like cold something or anything started, then you start thinking that maybe you have a coronavirus. So please take rest. Absolutely, please leave all your routine work. So in the beginning, If you are vaccinated, it will be settled down after 2-3 days. It will nothing goes to serious. So this is the situation. Everybody should very vocal and advise people to just be careful if you have any symptom in the beginning. So
my question
for you,
is,
Dr. Hussain,
I just like to know, those 7 doctors died. Is those vaccinated doctor, which vaccine is related majority death?
it includes Sinopharm and Pfizer mostly.
Okay,
So,
thank
so
you.
actually, Dr. Akhtar was asking actually whether you can just differentiate that whether there was any Pfizer case also there in the seven casualties.
Well, we can't differentiate, but the doctors who have died mostly were vaccinated with the Chinese vaccine, Sinopharm and the Sinovac.
For a BBT, actually, we lost here, as Dr. Sajjad asked, actually, we lost actually more than 170 doctors here in Bangladesh so far.
So far, okay.
Yeah.
Sad to hear all this. Can I have further updates from Dr. Salma and Prof. Ashraf? Anything to say?
Thank you very much, Mr. Chair. If I'm allowed to speak. Very interestingly, what situation we are turning at Pakistan, not going into the discussion what Dr. Kaisar Sajjad has shared, that is the statistical data in Pakistan certainly. We are having a phase over here that along with COVID-19, we have the cases of dengue. So it is what situation in Pakistan along with dengue. Now we have also some GI problems and people are with the bacterial infections too. As far as the diagnosis is concerned for the COVID-19, now it is the situation particularly in part of the Karachi and Lahore south and upper part. And this is what condition in Pakistan. And if I call it, not to be fair to saying that it is a very interesting situation in a way, that the diagnostic criteria or diagnosis for the patient suffering from the COVID, it is a bit now problem for us in Pakistan, but we are facing over here. In Lahore, we have about more than 500 cases of dengue. Unfortunately, we had a one death because of this dengue. Only one cannot say only one death or the only something. It is alarming for us as far as the situation is concerned, but it all is very much under control. I would like to share the concern which Mr. Chaudhary has raised about the traveling, that WHO and particularly I think the World Medical Association, we as the association have to speak about that the traveling, and once the vaccine is being recognized by WHO, it should be recognized by all the countries, and traveling is now becoming a problem because of the testing, because the traveling agents or the countries, they are asking for 72 hours before, and it is creating a lot of problem. I think, Mr. Chair, that the CMAAO, we can also, or we shall write to the WHO and the countries and raise this point within the countries what we are representing as CMAAO, that the vaccination program or the vaccines which are recognized by WHO, that should be accepted by all the countries. I agree with Mr. Chaudhary that this is the situation which we have to deal with. And I think we should also write to WHO and WMA about it to raise the voice and create some convenience to the traveling people. Thank you very much, Mr. Chair.
Actually, I just add, Dr. Nizami, that this is a very serious issue, and Pakistan Medical Association already have written this a letter to the WHO, to Dr. Tedros, and we have already requested in the beginning of the month of August, that those vaccines which are being recognized by the WHO should be accepted to every country, every part of the world. So it will create a problem. I requested all the National Medical Association should write individually to WHO to just pressurize them, and CMAAO, on the plate of CMAAO, the president or the secretary general should write to WHO to request them to please implement those vaccine, the world to accept those vaccine which is being recognized by the WHO. I think it should be done immediately by the CMAAO, and all the National Medical Association write a letter and request them to WHO.
I will speak to Dr. Kloiber about this. All right.
Okay,
now,
thank you.
Chair, can I ask a question to Prof. Ashraf Nizami? You mentioned about dengue fever. Do you think there's a relation between the COVID-19 and dengue fever mortality and morbidity?
Absolutely not. It's absolutely different.
Yeah, I think, Sajjad has answered Hussain. I think it is not, doing with the COVID and the dengue. As you know that in Pakistan, and we have suffering from, and every cycle of dengue that comes after 2 years. Now it is a time that Pakistan is supposed to be, that we will have some dengue cases. And in between dengue and COVID, I think there is no relationship between these two diseases.
Thank you, Dr. Nizami. Actually, Dr. Akhtar, actually in Bangladesh also we are having this problem. I know one case was having both the dengue and the COVID. Interestingly, yes, that is very just opposite. You know, the pictures and the treatment both are opposite. But I don't know how this will be mitigated. It's very interesting.
Thank you.
Here in Pakistan, at least in my knowledge, we don't have such cases that there is the COVID and at the same time a patient is suffering from dengue. But it is very interesting. I will look into in Pakistan and I will come up in next week definitely about it if I found some case.
Thank you, sir.
Thank you. Can we hear from Dr. Pillai on what's happening in India, and then Dr. Joshi? Thank you.
Thank you. India, of course, the situation is under control. The last 1 week, the case load is coming down compared to yesterday. Today, we have 13% less number of cases. Even then, it comes to almost 29,000 cases. But then this is being contributed by mainly 2 states, Kerala and Maharashtra. If you look at, if you set these two apart, then we can say that it is absolutely sort of the second wave has tapered and stopped. And even if the third wave comes, because we have been immunizing, vaccinating people, the ICMR expect that it will not be much severe. By now we have vaccinated 60% of our adult population, which comes to almost 80 crores of people have been vaccinated, either 1 or 2. So in that area, our performance has been very good. Even one day we could almost vaccinate 1.2 crores of people. So that is the level of vaccination that is being happening. Now that we are starting to open the schools, and the emphasis is now to consider vaccinating children from 12 to 14 years. So that is under consideration. Even the disabled people who cannot come to vaccine centers, door-to-door vaccination program definitely is being encouraged in the country. So generally we are, the situation is under control. Vaccine availability now is very good, and government is planning to sort of export vaccine, particularly to those countries where we have already made a promise of supplying vaccine. So that level of comfort definitely is there. Then pregnancy-related COVID mortality definitely is high. And so now the Gynecological Society is insisting that every pregnant woman should be vaccinated. And even that program is definitely picking up. When the adults were vaccinated, there was an increase in the number of cases in the children, but then those have been very mild, and almost there have been no deaths among the children who contract COVID. So that is generally the situation in our country. No lockout is there, but local confinement zones are there where the number of cases are high. our R value has come down to less than 1, which has been 1.2, 1.6. So that again is a comfort zone as far as India is concerned. Thank you. And so things are under control, and the third wave preparations are there, but we feel that is not going to happen in India. Thank you.
Thank you, Dr. Pillai. Dr. Joshi, is Dr. Joshi around?
And one word, let me add on regarding telemedicine. The Indian Medical Association is not encouraging telemedicine because most of our general practitioners are much senior and in remote areas where the 4-band is not sometimes available, and they are not very versed with telemedicine and all. So if that is encouraged, then general practice definitely will be taking a back seat, which definitely is not good for the healthcare of the country. But then telemedicine at sort of consultative level, a specialist can interact with another specialist regarding the patient's condition and not directly treating it. But to some extent, telemedicine is there. And another aspect is that the telemedicine will be taken up by commercial groups, and the role of the medical profession definitely will be marginalized. So for all these reasons, we are not encouraging telemedicine in our country. And on the other hand, we are seeing to it that the confidence level among general practitioners to go back to practice, we are building up, including giving PPE kit, mask, sanitizer, and things like that. Thank you.
Thank you, Dr. Pillai. Dr. Chaudhary, you have something to ask?
Yeah, Dr. Pillai, could you please enlighten us about the trial going on regarding the Zydus-Cadila vaccine and other vaccines in India? And moreover, you were just mentioning which you are concerned actually we should get the vaccines from India. We are supposed to get it, but it was stopped. The export was stopped. Now, when this export will start, can you just tell us about these things?
You know, the government has taken a decision to fulfill our commitment regarding export of vaccine, and soon it will start.
And what about the trials going on actually regarding Zydus-Cadila vaccine? That is a very interesting vaccine. Actually, there's
the DNA vaccine trial, plasmid DNA vaccine trial. The human trial, the clinical trial, and third phase has been completed, and the drug controller has given permission for emergency use, and further studies are being carried out. And that's where I said the DNA vaccine is much more safe in children. So our program of vaccinating school-going children, maybe the DNA vaccine will be utilized, but we are not really started from clinical stage. We cannot really started to give it to children so far.
Actually, Dr. Chong, tomorrow we are finalizing here in Bangladesh the SOP for telemedicine. I am one of the members, so I am very much interested about this matter. I am very much concerned, which I just raised it to Dr. Sheen. Actually, I heard it from them. So we are very much concerned about these things, and we're just taking up these things into account. And just Dr. Pillai mentioned this. I could not get it. Actually, it will help what we say. The remote places, actually, they will benefit it. Actually, so we are supporting it, so that we can just start the telemedicine in that way.
Dr. Chaudhary, I can add something here. I was very much involved with telemedicine with Dr. K.K. Agarwal in India.
Yeah.
When we started seeing the rush, when we started seeing that the number of patients are exceeding so much that, it is difficult for a doctor to just go ahead and see the patient and also give a quality advice. So there were two aspects what we created in that, especially during the pandemic. In that scenario, when there was a symptoms of loss of taste and loss of smell, which is a common symptom, and a lot of people would be in the similar category. Similarly, somebody who is having a first symptom of diarrhea, or third, or the second person is like somebody who is having a certain problem, which is into a same category. So we created a raw platform first. We bring all the groups together. So diabetic patients came together. and we consulted them on a similar platform, on a single platform. So which means that we were able to give a mass communication, because this COVID pandemic was the only, where a lot of patients were having a similar disease. And it was creating a confidence for our patients, because what was happening is a lot of people were in the depression. A lot of people were falling down because they were saying that, okay, my God, I got a COVID. I can't touch my baby. I can't do. So that depression part was getting into the nerves of the people. What it created is, when they saw 100 people sitting next to them with a similar problem, it not only boosted the confidence of a doctor and a patient together, but also the advice which was coming. And then if I see, okay, this guy is sitting on the second day, I'm on the first day, or this guy is sitting on the 10th day, I'm still on the first day, this person is safe, so I was safe. So there are aspects which are positive to our telemedicine. There are aspects which are negative to our telemedicine. We also give one-to-one telemedicine advice. We actually treated almost like 500 patients every day during that peak of the pandemic, which was not possible in a physical platform. But if you are trying to say that somebody can replace the complete system of medicine into a telemedicine, which is also not possible, because there are negatives behind it also. So this is something which can add a booster dose for a medicine, something like that. This is my two cents of it.
Okay, thank you.
We did a lot of work on it.
If I am to add on to that, for COVID, of course, to some extent, it has to be encouraged, particularly the awareness and counseling to COVID patients, and clearing their doubts, and they may be getting treatment, but this sort of counseling part of it, definitely through telemedicine or help desk, you can do it. But you cannot stretch it to other diseases, where, as has already been mentioned, ENT or ophthalmology, absolutely, or even neurology and all, where specialized investigations are really required. We cannot stretch it further.
Dr. Pillai, actually, we have already endorsed it in the Bangladesh Medical and Dental Council. From our council, we have done it from several months before. But the government is actively thinking, and they are going to finalize it tomorrow, what I say. And what we said, that in the other hand, there must be a physician. There must be a physician who can take the history and who can support him, who can assist the patient. It's not that you can call the doctor from home and do take your treatment. It's not like that. So we have also restricted some sort of medicines can be allowed, not all. So this way the Bangladesh Medical Dental Council and the government itself are doing it. I think this will help.
Yeah, the restricted way it can be encouraged, particularly from a doctor to a consultant sort of thing, and restricting the medicines that can be prescribed through telemedicine. So those sort of checks, if they are there, to some extent, we can promote it. But at the end, it should not become another commercial area where the medical persons and general practitioners are getting excluded.
Dr. Chairman, with your permission,
if I could have been,
Mr.
Chairman. Yes, Ravi.
Chairman,
thank you.
Mr. Chairman, Saurabh, I'd like to just make a comment here. It appears this telemedicine is a huge topic and seems to be of high interest.
Absolutely.
Maybe you all can arrange one session just on telemedicine.
I will do that.
I think maybe next week or week after next. The second thing that I would like to bring up is there is a lot of interest now about vaccination of children below 12 years old. Because of late in Malaysia, a lot of children, 3 years, 5 years, 7 years, have been infected with COVID. Probably if you can get, I don't know if Monica can help you to prepare and present this in the next 2-3 sessions or something like that, because these are of high interest. I see now that the telemedicine is a very huge topic, and we are now deviating from our own session now at the moment. Thank you.
Thank you.
Okay, if I may, I'll just give a few slides right now. I'm sorry, because I actually do have a slide on this that I can talk about for kids, and I can give you your answer today. Okay.
Excellent.
I just want to be, in interest of time, I know we're going over today, so I will try to be quick, and please leave the questions until the end. I will be sharing my screen right now.
I think we should be good, so we can have.
Can you enable my ability to share?
Sorry, yeah. You're allowed now.
Okay. Thank you. Okay, so what I'm just showing you now is the American experience right now. I showed a similar slide a couple of weeks ago. The light blue cases represent your adult cases and your child cases represent the navy blue. This represents week by week case spaces. This has been updated from the American Association of Pediatrics until September 16th. And what you're seeing is that you see a wave now that begins in August and it's continuing until September, representing the start of the school year. And most school has opened in person, very little virtual. There have been isolated areas and districts that have gone virtual as cases has increased, but by and large, the country has been in person for schooling. So what is our state of vaccination in the country? What you are seeing, and let's look at those who are 12 and older. So what you are seeing here, as I'm circling this number, 75% of those who are 12 and older have received at least one dose. And you're seeing about 65% that have received 2 doses. I think this is very promising because as we look into the lower age ranges, it's still important that we continue to address those who have received at least partial authority through EUA or full FDA approval to receive immunization. So this is the state of the immunization in the United States as of today. In terms of vaccine equity and making sure that there are vaccine doses, and in reference to the conversation that has happened today, President Biden wanted 70% of the world to be immunized by this time next year. He is sending 500 million doses in 2022. There's been comments and there has been criticism about the timeline of what he's trying to do, and he's really encouraging some of the other nations to donate as well. The other criticism is why are we donating vaccines? Should we be donating money so that other nations can purchase the vaccines? But of course, there is the inability to procure those vaccines right now. But there are efforts, and this was in news, as you can see, that was released on Wednesday, that's 22nd of September. Now let's talk about boosters, because boosters has been a big topic this week in the United States. This is coming from the Morbidity and Mortality Weekly Report, which comes from the CDC. And what I've highlighted in the yellow box here is showing those who've had vaccine efficacy of 91%. That's 14 to 120 days after vaccination. But then when we look beyond the 120 days of full vaccination, that you're seeing a 14% decrease to 77%. And this is coming from the CDC. So we're seeing that the vaccine efficacy is dropping as time exceeds from the time of the second dose or your complete immunization. If you're looking at those with severe illness, in comparing those who receive a booster versus those who do not receive a booster in age 60 and older, there's a 19.5 adjusted rate ratio in terms of having a severe illness if you are if you've not received the booster dose. So there is a 20-fold benefit in those who are over the age of 60 for receiving the booster dose. So what's been happening this week? It's been a busy week. We had the Vaccine-Related Biological Products Advisory Committee, which is an FDA advisory committee, who recommended that 16-2 in favor of against the booster for 16 and older. So looking for a blanket booster for 16 and older. They voted unanimously in favor of those over the age of 65 and judged to be high risk of severe COVID 6 months after the initial vaccine dose. This seems to be in line with what the rest of the world has agreed upon. In terms of healthcare workers and others at high risk, they did recommend that those who are at occupational exposure should receive this as well. So when we're talking about physicians or healthcare workers that who are vaccinated and who are passing away from COVID, one of the issues that we can, or factors that we can address, is that we received our vaccinations so early in the cycle of vaccine availability. And we are more than 6 months out in the majority of cases when vaccines became available. So if we're catching COVID now, then theoretically we have a higher risk of having a higher risk of morbidity and mortality because of the anticipated waning of the vaccine. So in this FDA advisory committee, they recommended the healthcare workers and those at high risk for occupational exposure should receive this as well. So the US has had 1 million people prior to this week's news who had already received the booster dose, and that data is being looked at, and I don't have that data today. So now let's look at the CDC Advisory Committee on Immunization Practices. So this is Friday night. This is the 24th evening for me right now. So 24 hours ago, this was released, and they voted 15-0 unanimously to recommend booster dose for Americans age 65 and older, and those patients who are in long-term care facilities. So again, this is in line with what majority of people agree upon. And those who are they fully recommended giving a single booster dose to people between the ages of 50 and 64 with certain high-risk conditions by a vote of 13-2. But the question of whether to recommend based on individual benefit and risk for those between 18 and 49 with underlying medical conditions was a little bit narrow in terms of how they voted for this. So those between 18 and 49 with underlying medical conditions were recommended to receive a booster dose. They voted against a booster dose for 18 to 64 who were at risk at COVID-19 due to their occupation or living conditions. So that would be the healthcare workers. So this is in contrast to what I had shown you earlier about what the VR-BAC had initially recommended. Then last night at midnight, or it was in today's news cycle, that the CDC director, Rochelle Walensky, she overruled what the ACIP had said and said that those who are at risk of COVID-19 infection because of their job should be eligible for a booster. So we are currently in very murky waters. We're continuing to wait for further guidance. What is very clear is that those who are 65 and older, those with comorbid conditions, should be eligible for the booster doses. So this is kind of a graphic that I've created based on a list of countries that are currently offering booster doses. And they, in this, interestingly, in this group that they've included in this list are those who are 65 and older or who are healthcare workers, where now the United States is the most recent country to have been added to this list. And if your country is not on this list and you are recommending booster doses, I do apologize. Okay, so now let's go back to the original way that I started this conversation was that what is the data for children, and especially for our children that are going back to school in this academic cycle. So this is news from Monday, from 5 days ago, and what they found is that Pfizer-BioNTech showed that in their trial this is their news release in children who are 5 to 11 years, that they had efficacy. Now they defined efficacy by neutralizing antibody responses rather than hospitalizations, pneumonia, severe disease, or death. So this is what they looked for as their endpoint, and they looked for neutralizing antibody responses. These children received a dose that was 10 micrograms, 21 days apart, and that dose is 1/3 of what has been recommended for those that are 12 and older who get 30 micrograms and older. So right now, this data is being reviewed. I believe when this news came out on Monday, that what I had heard was that they were anticipating that the FDA would have a decision about use in this age population by October. And that would be around the time that we received the seasonal influenza immunization as well. We do know that the influenza immunization is safe to be given in conjunction with the COVID-19 vaccine. And thus we would be able to address the multiple viral infections that can be found in our school children. So that's the end of what I had prepared quickly for today, just to give you an update as to where we are in the United States.
Can I say something, Monica? I did my neutralizing antibody test. We call it CPAS here in Singapore. It was 48% in August. I did a Sinopharm booster on 4th of September, and I did my CPAS 2 weeks later, and it was 86%. So this was a mix and match situation. I wasn't eligible for the healthcare booster because it's only for those who are 60 and above in Singapore. They've since revised that to 50 and above yesterday. But, you know, it was quite interesting that my CPAS neutralizing antibody was boosted by the Chinese inactivated vaccine.
Yes. I'm just going to share my opinion. This is my personal opinion. I've mentioned it before, but I believe that mixing and matching vaccines of mRNA and viral vector, and it'll be interesting to see in the future with the DNA vaccine and with the Novavax, which I also know is undergoing trials in India, which is a protein subunit-based vaccine, that if you employ two different vaccines of two different mechanisms of action, that you will stimulate immunity, whether it be B cell, T cell. I think that you will have much better benefit. So I've received 2 doses of Moderna. I would love to receive a dose of Novavax, for example, if that was available, because that would cause it. But in any case, I believe that boosters will be required and will be beneficial. So thank you. I know that was a little bit lengthy, but I covered a lot of information there.
Yeah. And what is the cutoff for the neutralizing antibody in the children's trial? Did they mention?
I don't, because all they'd mentioned was this was the press release. I didn't actually see the primary data.
Okay, we have unpublished data in Singapore that shows that an 80% neutralizing antibody level is very protective. So that's our.
Dr. Tong, is it the result of a trial?
No. It's just unpublished data. Somebody showed it to me. So quite interesting. We don't have a trial.
Dr. Monica, why it's not determined actually? So many days have passed. Is that minimum? This is cut off. What Dr. Chong was.
We have not done this. This is not being done clinically in the United States. We have really discouraged the measuring of antibodies in clinical practice. So we don't routinely do this. So I think that's why we don't have a culture of cutoff. And the access to like ambulatory testing is not as robust as we've seen in other countries.
No, all right. Can I just show? I'm just sharing screen to show you what's happening in Singapore. So unfortunately, our cases in Singapore have now exploded. We have 1,500 cases as of today or yesterday. And the situation here is we have 82% vaccinated with two doses and 84% vaccinated with 1 dose. And the total number of people vaccinated in Singapore eligible will be 92% because 8% are children below the age of 12. So we're almost there, almost fully covered, but yet we have a large number of cases. We have about 1,500 cases a day now. So most of them are very mild. Numbers in ICU are very few. The numbers in ICU are in the maybe about 32 in ICU. The number of deaths are about 70 so far in the whole almost 2 years. So our death rates, mortality rates are very low. But we're very concerned with the total number. And at this moment, what we're doing is we are having a situation where we ask the patients, if they're symptomatic, to do ARTs, acute rapid antigen tests, and to stay at home, and then retest themselves 3 days later. And if they're perfectly well throughout the situation, stay at home and not go to the public hospitals, because our public hospitals are in the process of being overwhelmed. Our ICU capacity is still all right, but the public hospitals, general wards are being quite overwhelmed. So that's where we are at this point in time. Thank you.
Dr. Chung, can you explain? Actually, you're following the strict measures there. Why the cases are increasing? And most of the people are vaccinated.
You ask a very good question. So what our ID guys think is this. Now, the moment that, okay, so if your neutralizing antibodies are high, you're not going to get infected by Delta. But the moment your neutralizing antibodies drop for whatever reason, due to the length of the vaccine and so on, the Delta comes in. The incubation, according to our data locally, the incubation of Delta in Singapore is 3 days. So, and from some data that our immunologists here, and perhaps Monica can figure this out for us, is that it takes about 4 to 5 days for the immune system memory to kick in, to ramp up. So in that 4 to 5 days, Delta appears in that 3-day window period. And that's why at the beginning, when they're symptomatic, their viral loads for vaccinated people who have COVID, their viral loads are just as high as those who are not vaccinated. But of course, in the next 2-3 days, the immune system ramps up and then the viral loads start to drop. So as a result, we are getting this, and I think the Delta here in Singapore came from Indonesia. I think it's a little bit more enhanced than the original version that came from maybe Delta on steroids. So this is what we think is happening in Singapore. And we're getting 1,500 cases as of yesterday. So it's a bit shocking, but fortunately, the majority of them, because we're all heavily vaccinated here, are very mild and asymptomatic. Monica, would you like to comment on what I said about that window?
Yeah, I'm actually trying to find a graphic right now because I had it in one of my presentations where it gives you kind of like the timeline of the B cells and the T cells.
Yeah,
I'm just like going through all my presentations right now. So let me see if I can find it.
So what we have in Singapore is we have fantastic public health measures. We have the TTIQ, test, trace, isolate, quarantine, masking. We have a Trace Together app, 100% of the population using it. We managed to reduce the R0 from 6 to 8. We figure it's 6 here in Singapore. The Delta here is 6 to 1.45. And even then, we're getting 1,500 cases a day. So
also, I think in Singapore, the migrant workers are also being quarantined and in lockdown.
Yeah, they're all in lockdown. So we, I mean, I don't have a good answer for you, Dr. Chow, but Monica can share some light.
Dr. Chow, whether the nasal vaccine can help you? Do you think it is going on in India? Trial is going on. I have.
At the moment, we've started boosters for those above 60, and those above 50 was just announced yesterday, in line with CDC's recommendation. FDA. But healthcare workers are still not vaccinated yet. Although we were very early, we got our Pfizer vaccines in January, February. That's why in August, in 6 months' time, my CPAS had already dropped to 48%. So
okay,
this is
what booster dose you got? What booster dose you got?
Oh, I got Sinopharm. I took Sinopharm because I wasn't eligible for Moderna or Pfizer yet. You know, so I took Sinopharm. But as of yesterday, we are eligible for Sinopharm. So for Moderna and Pfizer vaccine as of yesterday. So Monica, have you found your slide to show us?
No, just one question here. Like in your case, you took the Sinopharm as the booster.
Yeah.
What difference would have been if it had been a Pfizer or Moderna?
Well, I don't know.
Dr. Monica, can she enlighten us?
I don't know. But I'm
Dr.
very
Monica
worried.
is getting bounces from us now.
Yes, right. Actually, mix a match. Actually, that is the thing.
Yeah. Excellent.
Yeah, I remember. Yes.
So I'm showing here, which is your time from infection to what the different parts of the immune responses are. So if you have your incubation period that can last several days, and it depends on what your I think that's also a function of your R0 as well. With Delta would be a lot shorter than it would be with any of the other variants. And what you're seeing here in the first blue line here, I'm sorry, there's a lot of blues in here and shades of blue. This is your innate response. This is like your macrophages, it's your complement, that's your innate response. You then see viral replication that shoots up right away, and you start get your cellular response. Your cellular response is your T cells and your other cellular components. And then you have your early antibodies that usually happens like on day 8, and then they can extend out. So this is, I think, the timeline that you were talking about. And that's your IgM antibodies. But your IgG antibodies, which we typically test with our serology, is seen on day 10 and after that. So that's why, go ahead.
Sorry, Monica, but this is different if you have been vaccinated, right? It's a different kind of.
So this is to native infection. So what we see with, so that's a great point. So this is with native infection. With vaccination, you get a much earlier and much stronger antibody response. But I can't quantify the other cellular responses for you because we're not measuring that. So I don't know that.
Yeah.
Right. I believe there was, like I had shown this slide as well, too, just showing you that immunity is variable, and this is also to natural infection, that that you don't know at what point you've got memory B cells, you've got antibodies, you've got CD4, and you've got CD8 T cells. And then you're looking at what's the receptor binding domain, IgG, you're looking at specific memory B cells. And this is just with natural infection. Our assumption is with immunization in an immunocompetent host, you get a spike up and it remains much higher. Yeah.
So from our Trace Together app in Singapore, we know that the delta here is 3 days of incubation. So that 3 days must fit into exactly where, you know, it took a while for the response of the vaccinated people to kick in. Just probably just outside the 3 days. That's what we're thinking. You know, like maybe 4 to 5 days. And that's why the viral loads drop very fast. And right now, for the vaccinated people who got COVID, what we're doing is the moment you have symptoms, which is probably day 3, right? That's when you have symptoms. You do an ART. We ask you to do ART 3 days later. And if your ART is positive on day 6, we assume day 6, then to do a PCR. But if it's negative on day 6, rest at home, don't do anything. So we're figuring that the immune response for a vaccinated person will probably kick in on day 4, day 5 in an overwhelming manner. That's what we figure.
We hope to see your data being published.
Yeah, I hope so too.
Yeah, well, because anything that you publish, right? Everything, the information is coming out so fast, and everything that we publish is based on a variant that was existent, you know, that time.
Yeah.
Okay. Left with, yeah, we can continue because we just have 8 minutes left, and it was a good discussion. Yeah.
Okay, thank you. So I think a very good discussion on what's happening, and I think telemedicine and the pediatric issue was kind of you know, covered by Dr. Vasudev, by Monica. So I think we look forward to a telemedicine module next. And if is there anything else that anybody wants to bring up? If not, we can call a meeting to a close for the first time.
I think we have Alvin here.
Is Alvin?
I just saw him joining in.
Alvin is not here.
I just saw him 5 minutes back.
He's not
Or
here.
he just left. He must have left.
Comes and goes.
Dr. Prakash is there.
Oh, then we have time.
Dr. Kazi, anything to talk to us about? Dr. Kazi?
Yeah, Dr. Kazi has just joined.
Yeah, Dr. Kazi, has he got anything?
Okay, thank you, Chong. It's wonderful listening to this excellent presentation by Monica, and it was wonderful knowing the importance of booster dose and what are the guidelines available and how we can proceed with that. So it was wonderful. Thank you for allowing. Thank you.
Welcome, Dr. Ghazi. And anyone else has anything to say before we call a close to our meeting today?
We should cover up our 6 minutes, otherwise next time they will ask us to.
There's one thing I forgot to tell. Prof. Ashraf, I understand you're running for WMA president. Would you have something to say to us, Prof. Ashraf?
Yeah, thank you very much, Dr. Chong, that you have given me this opportunity. Yes, it's true that I have been nominated by my National Medical Association, Pakistan Medical Association, supported by some other countries too, to run the election for the position of President World Medical Association. Simply, I will request to all of you for the kind support and certainly to take the flag high of the CMAAO. Hence, I have been serving and served as first vice president and good colleague to all of you. So this is what I can request or I can say about it. Thank you very much.
Dr. Chong. Dr. Chong.
Yes, Dr. Sajjad. Yes.
Yeah, I, on behalf of the Pakistan Medical Association and as a Secretary General Pakistan Medical Association, request all our friends to vote Dr. Ashraf Nizami as a presidential candidate. So this is my request to all of you. Thank you very much.
Okay,
I think CMAAO definitely will back one of our own. CMAAO will definitely back one of our own persons for WMA president. I think we will all know what to do. So everyone, please do so. Please inform your MNAs to cast a vote for Prof. Ashraf. All right, and we wish him all the best.
Good luck.
Thank you very much.
Good luck.
Thank you very much. Thank you very much, Mr. Chair. Thank you.
Actually, Dr. Chong, from today's meeting, actually, the question was raised regarding the acceptance of this vaccines throughout the world, which are recognized or endorsed by the WHO. So CMAAO should write a letter to WHO and even to the WMA, so that in the WMA conference, which is coming up on 7th October, we should raise this voice together, so that we are not suffering anymore in case of trouble. And this is actually, moreover, the point now is raised throughout the world, that the people should be vaccinated, more than 70% throughout the world, to save the world and to resist the mutations, which we're afraid. Even the US and others also are talking about this. So why we are not opening the production of the vaccines in different countries? We have got a lot of capabilities in Bangladesh. We have dealt with China to produce here or to market here, to bottle up here, not to produce, but to bottle up here, but still it's not going on. Probably some sort of memorandum has been signed. But I think this should be opened to save the world. And this also has to be raised, actually, so that more productions, more people are given vaccines together, not waiting for the next September or October next year. Why to wait? This is also should be raised, actually. This,
Dr. Chaudhry, I will discuss this with Dr. Kloiber and Hashim, our Secretary General Hashimoto. All right, I'll follow up on this. Not to worry.
Good,
yeah.
Good.
Meanwhile, please everybody support Prof. Ashraf for his run at the WMA presidency. Please do that, and I'll call today's meeting to a close. Thank you very much. Thank you, Monica, for those slides. Thank you.
Thank you everyone for joining in. And
see you next week.
good day. Have a nice day.
Thank you. Thank you very much.